More vaccines, more tests, and more treatments for monkeypox. That's what some health and LGBTQ plus advocates across the nation are demanding from the federal government. Though the White House is gearing up a team to address the virus, they say it's not enough. News 12's Caitlin Ulrich has the story.
This outbreak continues to grow out of control, and many of us warned that this would happen 6 weeks ago.
This morning, representatives from the National Coalition of STD Directors, state health departments, and more called on the White House to take swifter action against monkeypox. And though Monday, President Biden announced a team to lead the monkeypox response, advocates want more.
This is welcome news, but where is the declaration of an MPV public health emergency?
Executive Director of the National Coalition of STD Directors said the feds need to designate more money to tackle the virus, specifically for sexual health clinics. And doctors say symptoms can mimic STDs, and patients may not think it could be the monkeypox.
I think what's key is that doctors should have a high index of suspicion and just be acutely aware that they should always rule out monkeypox. And patients should also say to their healthcare provider, please evaluate and make sure, I don't have it, at least consider that.
Though the virus doesn't solely impact the LGBT community, local advocates say they will continue to apply pressure on the federal government and hope the outbreak will not receive a delayed response, like the beginning of the HIV epidemic in the 80s.
So I hope that's, not where we're going with this. But of course, we have seen historically, right, with the HIV/AIDS crisis and other issues affecting the LGBTQ community, that folks are slow to respond to the needs of our community.
Dr. Youssef says there are barriers to vaccines, with too few available to protect all people. And with the virus largely impacting the LGBT community at the moment, she says she sees a lack of urgency in other communities to get educated. She says the virus is highly transmissible, and the medical community is still learning how it's transmitted. In Canarsie, Caitlin Ulrich, News 12.